We're at the 25th CROI. We're here with Paddy Mallon, who is from the University College Dublin in Ireland, and we really appreciate you. Just got off the press conference, which discussed a lot of cardiovascular issues. And I wanted to let you speak to the issues TAF versus abacavir. And if you could, well, let's talk about the work you did and then how it influences treatment.
So we've been interested in the whole association between drug exposure and comorbidities in general, and more recently between exposure to antiretroviral agents and myocardial infarction or heart disease. Heart disease is the #1 cause of death in America in treated people living with HIV, and it occurs much more commonly in people living with HIV than the general background population. And several studies going back almost a decade have looked at associations between antiretroviral drug exposure and heart attacks, and the most controversial of those has been an analysis by the DAD study, which showed a roughly doubling of risk of myocardial infarction in patients that were on abacavir compared to those that weren't on abacavir. This has been a very controversial finding, first reported 10 years ago. Subsequently has been confirmed by a large number of studies, but not consistently. So there's some studies that show it.
Yeah.
So, and there's never been a big enough randomized controlled trial to look at this, because you would need large numbers of people. You'd need to be following them up for years. And you could argue that it could be quite unethical to conduct, and not many people would want to take part in a study where, the end point is heart attack, right?
Exactly.
So I think what we're left with is a scenario where we have this data that is controversial, but what we need to do is to try and explain why it could be happening. And if you can find an underlying mechanism that's consistent with an altered risk of heart disease, I think it really drives the field forward, and that's where our focus has been. So we've focused on platelet function. Now, platelets are components within your blood that help your blood clot. So for example, when you cut your finger, the thing that stops the blood from continuing to flow is the platelets group together or aggregate. They form a blood clot, and that stops the flow of blood. And that's also important for repairing damage in your body within blood cells. What we found initially about 2000, we published this in 2011, was when you take a group of people on abacavir and a group of people not on abacavir, and you look at how their platelets clump, people on abacavir have more reactive platelets, so they're more likely to clump or aggregate is the word, so their platelet aggregation is higher. Now, that was done in a cross-sectional study. It was nice. It's been shown by a couple of different groups since. But what we've had the opportunity more recently to do is to look at other markers of platelet function. In addition to this aggregation, we can look at specific receptors on the surface of platelets that can correspond to altered platelet function. So we've been bringing a lot of these various lab assays together under one roof. What we wanted to do was to look really comprehensively at platelet function in the setting of a randomized controlled trial, where we could determine if there was an abacavir signal, because that's the best quality data is from randomized controlled trials. So we got the opportunity to do this through a study that Gilead were running called the 1717 study. It took people who were on abacavir, virally suppressed, and they were randomized 1-to-1 to either stay on the abacavir or switch to an alternative drug. And we performed the full suite of platelet tests on a subset of people from the trial, 61 people in total, recruited from 4 clinical sites in Dublin and in London. And what we discovered was that very early after switching away from abacavir, within 4 weeks, we see a difference in platelet aggregation. So if you switch away from abacavir to the other medication, in this case it was tenofovir alafenamide, your platelets become less reactive, which is a good thing. And we saw that when we tested platelet reactivity using 3 different assays. So it's a fairly consistent approach seen at week 4. We then looked at the expression of these various molecules on the platelets, and this was more from the scientific perspective to see could we tease down what is the exact mechanism, and we saw a difference in a molecule called glycoprotein 6 or GP6, which was different at week 12 in those that switched away from abacavir to TAF. So they got significantly higher GP6 levels on their platelets. And then when we looked in the whole study population over 48 weeks, we saw that the levels of soluble GP6 in the whole study population also increased significantly in those that switched away from abacavir to TAF. So overall, what this study shows is it's randomized, placebo-controlled, using a full repertoire of platelet function measures, that we were able to show that a switch away from abacavir resulted in less platelet reactivity and improvements in the levels of these important markers, really focused around a pathway called GP6. And we think that this represents really significant data because of the quality of the data, and it really focuses down on a specific but consistent pathway that's been reported several times in other scientific papers, but not to the same extent as this, which really leads us to believe that this is the defect with this drug that leaves people more prone to having myocardial infarctions.
So the glycoprotein 6 is a marker, or?
So glycoprotein 6 it's a receptor on platelets. It's only expressed on platelets, and it's a receptor for collagen. Now, collagen is a very important component of our blood vessels, and when a blood vessel gets damaged, the collagen inside the blood vessel wall gets exposed, and that drives the platelets to come and plug up that bit of damaged area.
Natural reaction.
Yeah. So what we're seeing is it's this collagen. The GP6 is the receptor on platelets for collagen, and what we're seeing is it's really this collagen-platelet interaction through GP6 that is the most likely defect in patients that are on abacavir.
That's the action right there.
That's what we think is the mechanism, which is why it's such a significant study, because we've been able to do this level of science within a placebo-controlled randomized trial and consistently show that this is the pathway that's most likely implicated.
This is probably, at least for me, because I'm in this boat, as it were, it seems as though this is one of the most important things that I would find out of this conference, as least important to me. And this is long-term stuff. This is people that are otherwise healthy. We have to find something to die of, but I'd rather it not be this.
So the participants in this study had been on abacavir on average 8 years. So these are people who've been very stable on their medication, good CD4 counts, and they're in their early 50s. They're in that age where heart disease starts to become, really does start to become an important factor. So I think this data is relevant. In my view, all of us who research drug safety and long-term outcomes in HIV, the whole thing is to try and maximize the safest and healthiest approach to long-term management. And where you see a drug signal, I think it needs to be taken seriously. And in my view, this is a very important drug safety signal.
Definitely. This was one of the more important press conferences because it had other issues about cardiovascular issues. And I really appreciate you taking the time with us. It's a very good explanation.
Thank you.
You brought it home. Thank you.
Thank you. Yeah.